This evening, we remember our brothers and our sisters who have fallen victim to our irresponsible, profit-driven healthcare system that places priority on profit instead of human rights. We remember Josephine Piton, 69, who was admitted to the hospital by her family physician because of undiagnosed severe pain throughout her body. After 3 days in the hospital and a battery of tests, her Blue Cross patient advocate reviewed her chart and permitted the Blue Cross tests and determined that the Blue Cross would no longer pay for her stay for undiagnosed pain. Discharged from the hospital, she returned to the emergency room 3 days afterward in agony and died an hour later. Rest in peace. We remember Natalie Sarkeesian, 17, a sufferer of leukemia. She died after being twice denied by her family's insurance company, Cigna, for liver transplant, and was recommended by a panel of doctors at UCLA Medical Center. Rest in peace. We remember Roger Godwin, 70 years old, who experienced severe pain in his back, but was denied access to an MRI by his insurance company and was prescribed therapy instead, which was not effective for the undiscovered tumor growing next to his spine. Because of this rejection of care, the cancer spread from his back before it was discovered, leading to tumors in his lungs, brain, liver, and most painfully, his bones. Roger died after struggling for over a year. Rest in peace. We remember Angelina Wesby, 47, who had health insurance but could not always afford the $500 copayment she needed for medicine to treat her colon and liver cancer. The pittance she received for disability prevented her from qualifying for Medicaid. She left behind 2 daughters, one of them still in high school. Rest in peace. We remember Mary Kay Kelly, 31, who had no insurance and was thus taken to the ER because of attacks of severe back pain. No x-rays or tests were taken, and each time she was sent home and instructed to do exercise. Over time, her pain gradually worsened, and her father eventually paid for a doctor's visit, at which time she was diagnosed with a tumor at the base of her spine and AML. She was admitted to the hospital and covered by Medicaid, but died 3 months later. Rest in peace. We remember Lucretia Ann Crow, 58, who was independently employed but had no health insurance. She was consistently denied any employment that included a health package to address her ovarian cancer. At the end of her life, she attempted to get Medicaid, but because she owned a house and several old vehicles, she did not qualify. She died in hospice trying to sell her possessions to qualify for Medicaid 2 years after her diagnosis. Rest in peace. We remember Barton Simon, 52, whose swollen arm was misdiagnosed 3 times. By Kaiser, his insurer, refused to pay for further tests. Later, when tests were finally done on his arm, it was revealed that he had stage 4 melanoma, from which he died 12 weeks later. Rest in peace. We remember Elizabeth Mockholm, 25, who worked for a movie theater and didn't have insurance. Her parents were still paying her medical bills from a previous condition, and she was worried about the cost of going to the doctor to address recent spells of dizziness. She collapsed in her bathroom a few days after her initial fatigue. She never regained consciousness and was declared dead the day after her 26th birthday.
Rest
In peace. We remember Estelle Hatley, 48, who developed a persistent cough and tried to buy health insurance but was repeatedly rejected because of her cough, which was considered a pre-existing condition. She was admitted to the emergency room where she had to lie and tell the local personnel that she was unemployed in order to get treatment that she needed. She was in the 4th stage of lung cancer, and she died 11 months later.
Rest in peace.
We remember Lorraine Scarpace, 59, who could not afford health insurance and therefore was unable to see a doctor for checkups. By the time she went to the emergency room in excruciating pain, the cancer had metastasized throughout her entire body, rendering it inoperable, and from which she died. For all the victims, named and unnamed, we remember you now, because when you die unjustly, we are all responsible. We all die. We all die. We all die.